is a meniscus and why is it important? Why do we need it?
Great question. So the meniscus is the most commonly injured of the knee structures. And really, the meniscus is the protective part of the knee. It protects the articular cartilage. The meniscus allows forces that would normally be destructive to be cushioned between the two ends of the bone.
Okay. So it serves as sort of like a barrier, almost like bounces a little bit. Is that how you would describe it?
You know, maybe mechanically you think as a rubber cushion between the two bones, but it's much more complicated, which I think we'll get into a little later.
We'll definitely get into it. And if you notice our desk, this is the hardware. This is what we need to put people back together. Is that correct? This is what is going to help that knee, those tears. Don't be modest. Let's go.
It's a small segment of things just to give you an introduction to what we use.
So give us a little bit of what are the different parts of the meniscus. What are we looking at? Our viewers at home who are joining us, they don't know. They want to learn more. Talk to us about what makes up the knee.
Perfect. So the meniscus is the fibrocartilaginous tissue or disc between the end of the femur and the top of the tibia, or the thigh bone and the leg bone.
Okay.
The meniscus has different zones, and the zones are described as zones in the back we call the posterior horn, the mid portion called the body, and the front called the anterior horn. Now the meniscus is anchored, which is very important, by its attachments in the back we call the root, just like roots in a tree, anchor of the tree.
And so this holds it?
Right, and the root up in the front that holds it in place. And all along the edge, the meniscus is held in place by what we call coronary ligaments or meniscal tibial ligaments, which hold the edge of the meniscus down to the tibia. And we have two menisci. You have one on the inside, which we call the medial meniscus, and one on the outside called the lateral meniscus.